Welcome. Today we're diving into the world of heart rhythm disorders, specifically focusing on supraventricular tachycardia, or SVT. We'll explore what it is, why it happens, how it's diagnosed, and what can be done about it. Understanding SVT is crucial for those who experience it, as well as for anyone interested in learning more about cardiovascular health. So, what causes SVT? In essence, SVT arises from an electrical misfire in the upper chambers of the heart, the atria. Instead of the normal electrical signal originating in the sinoatrial SA node, which acts as the heart's natural pacemaker, an abnormal electrical circuit develops. This circuit can be caused by a variety of factors. These can include congenital heart defects present at birth, chronic lung diseases like TOPD, thyroid problems such as hyperthyroidism, excessive caffeine or alcohol consumption, or even certain medications. Sometimes, the trigger remains unknown, and the SVT appears without any identifiable underlying cause. Let's understand how SVT affects the heart. Normally, electrical impulses travel a defined path through the atria node to the atrioventricular AV node, then down to the ventricles, causing them to contract. In SVT, the abnormal circuit short-circuits this pathway, rapidly re-stimulating the atria and subsequently the ventricles. This creates a very fast heart rate, often significantly exceeding 150 beats per minute, and sometimes reaching over 200. This rapid rate prevents the heart from filling completely between beats, reducing the amount of blood out to the body, leading to various symptoms. SVT is a relatively common heart rhythm disturbance. While it can occur at any age, it's more frequently diagnosed in young adults and those with pre-existing heart conditions. Women tend to be affected more often than men. The true prevalence of SVT is difficult to determine, as many individuals may experience infrequent episodes that go undiagnosed. However, studies suggest that SVT accounts for a significant proportion of emergency room visits related to palpitations and rapid heart rates. The signs and symptoms of SVT can vary significantly from person to person. Some individuals may experience only mild discomfort, while others can feel quite unwell. Common symptoms include a rapid or racing heartbeat, often described as palpitations. Shortness of breath is also frequent, as the rapid heart rate makes it difficult for the lungs to effectively exchange oxygen. Chest pain or discomfort, lightheadedness, dizziness, and even fainting can also occur. Some people may also experience anxiety or a feeling of impending doom. It's important to remember that these symptoms can also be associated with other conditions, so proper diagnosis is crucial. Diagnosing SVT typically involves an electrocardiogram, or ECG. This test records the electrical activity of the heart and can capture the characteristic rapid heart rate and abnormal electrical patterns associated with SVT. However, because SVT episodes can be intermittent, a standard ECG taken during a normal heart rhythm may not reveal the problem. In such cases, a Holter monitor, which records the heart's activity over a 24-48-hour period, or even an event monitor, which can be worn for several weeks and activated when symptoms occur, may be used to capture an SVT episode. In some instances, an electrophysiological study, or EPS, may be performed. This invasive procedure involves inserting catheters into the heart to map its electrical activity and pinpoint the source of the abnormal rhythm. SVT isn't just a single entity. It's an umbrella term encompassing several different types of rapid heart rhythms originating above the ventricles. The most common types include atrioventricular nodal reentrant tachycardia, or AVNRT, which involves a re-entrant circuit within the AV node. Atrioventricular reentrant tachycardia, or AVRT, utilizes an accessory pathway, an extra electrical connection between the atria and ventricles, to create the circuit. Atrial tachycardia originates from an abnormal focus within the atria itself. Distinguishing between these types is important as it can influence treatment strategies. Treatment for SVT aims to either stop an ongoing episode or prevent future occurrences. During an acute episode, vagal maneuvers, such as bearing down or coughing, can sometimes slow the heart rate by stimulating the vagus nerve. If these maneuvers are ineffective, medications like adenosine can be administered intravenously to interrupt the electrical circuit. For more frequent or severe episodes, longer-term management may involve medications to control heart rate or rhythm, such as beta blockers, calcium channel blockers, or antiarrhythmic drugs. In many cases, catheter ablation is a highly effective treatment option. This procedure involves using radiofrequency energy to destroy the abnormal electrical pathway causing the SVT, effectively curing the condition. While not always possible, certain lifestyle modifications can potentially reduce the frequency of SVT episodes. Avoiding excessive caffeine and alcohol consumption is often recommended. Managing stress and anxiety can also be helpful, as these factors can sometimes trigger SVT. Ensuring adequate sleep and maintaining a healthy diet are important for overall cardiovascular health. If an underlying medical condition, such as thyroid disease, is contributing to SVT. Effectively managing that condition is crucial. The prognosis for individuals with SVT is generally excellent. With appropriate treatment, most people can lead normal, active lives. Catheter ablation in particular offers a high success rate for permanently eliminating SVT. Recent research focuses on refining ablation techniques to minimize risks and improve outcomes. Additionally, studies are exploring the genetic factors that may predispose individuals to SVT, which could lead to new preventative strategies in the future. We continue to improve our understanding and treatment of SVT, offering hope and improved quality of life for those affected.